Symptoms: pain or swelling of the scrotum or testicle. Bilateral disease, rare in patients with torsion of the testicle or appendix. Testis: nausea or vomiting, common in patients with testicular torsion. Epididymitis, history of prior urologic instrumentation, painful voiding or urethral discharge. History of trauma, testicular hematoma, rupture, or dislocation. Can also be seen with testicular torsion. Signs: bilateral disease suggests trauma or infection. Erythema of overlying skin is a nonspecific sign. Testicular torsion, high riding and transversely located testicle, cremasteric reflex, absent in patients with testicular torsion. If present, this strongly suggests another diagnosis. 1. Location of tenderness, posterior in epididymitis, superior anterior in torsion off the testicular appendage. Scrotal pain without testicular involvement. Vasculitides. Investigations: complete blood count generally unhelpful in differentiating diagnoses. Epididymitis urinalysis reveals pyuria in only 1/3 of patients with epididymitis. Unhelpful in other diagnoses. Urethral swab for chlamydia sp isolation, chocolate agar for isolation of Neisseria gonorrhea. Serological testing for syphilis should be performed in any patient suspected of having a sexually transmitted disease. Testicular torsion. Handheld Doppler useful only for testing successive detorsion procedure. Color Doppler flow study useful in diagnosing testicular torsion in adolescents and adults, less useful in young children. Study of choice for children is radionuclide scintigraphy, technetium 99. Complications: delay in diagnosis of testicular torsion can result in non-viability of the testicle. Orchitis can result in impaired sterility, rarely infertility. Traumatic rupture or dislocation can result in ischemic compromise and subsequent loss of testicular viability. Incarcerated inguinal hernia can result in bowel strangulation, gangrene, and septicemia. Treatment: non-pharmacologic treatment for testicular torsion. Immediate detorsion procedure. Twist testicle towards ipsilateral thigh and observe for resolution of pain and swelling. 4. Surgical removal of non-viable testicle. Bilateral orchiopexy. Pharmacologic treatment for epididymitis. Sexually active patient and their partners. Standard dosage: gonorrhea, ceftriaxone 250 mg intramuscularly, cefixime 800 mg orally, single dose. Chlamydia, doxycycline 100 mg twice daily for 10 days. Azithromycin 2g orally, single dose. Prepubertal patients. Trimethoprim sulfamethoxazole 2 cubic centimeters per kilogram divided twice daily for 7 to 10 d. Other treatment options for torsion of appendix, testis/orchitis. Rest, testicular elevation, analgesia. For vasculitides, see pharmacologic treatments for Kawasaki syndrome, anaphylactoid purpura. Familial Mediterranean fever. For traumatic injury to testicles, incarcerated hernia, or testicular cancer, refer to appropriate subspecialist. Urology, general surgery.